of public hospitals in South Africa, and Gauteng is facing a beds crisis. That's where we begin our coverage. And not only that, there's also a shortage of nurses, doctors and other staff. This is South Africa faces a possible second wave threat as far as COVID-19 is concerned. It's got to be a nightmare for healthcare workers. Reporter Manqoba Mchunu has been assessing conditions in Johannesburg hospitals. He's with me now on that Monday lunchtime. So you've been to a number of hospitals. What have healthcare workers been saying to you today? How desperate are they?
Well, Jeremy, a very desperate situation. In fact, many of them saying that the current health system in Gauteng is in a state of paralysis. And this is due to those issues that you've mentioned in that intro, the issues of staff shortages, the issues of overcrowding in those hospitals, and also the issue of lack of equipment. We know, of course, that during COVID-19, this was one of the major issues that were raised by some of the healthcare workers, the shortage of PPE, for example, which we know was critical in this particular province in Gauteng. But many of them saying, Jeremy, it's a daily nightmare going to work simply because they don't have the means, they don't have the equipment to work. Some saying they are even forced to buy their own equipment due to the fact that hospitals simply don't buy new equipment, or the broken equipment is not fixed. So an example that one of the nurses, of course, spoke to us on condition of anonymity, told us is that in the ward that they work, they have to use one BP machine, for example, and the ward serves, that BP machine serves about 2 wards. That's 90 patients that have to use that one single machine. So in terms of also the issue of resources, they're saying that sometimes they simply have to watch patients die because there's not enough machines or enough equipment to deal and to try and help those patients. So one of them even saying, Jeremy, that the painful thing is that sometimes they have to make a decision between life and death. And sometimes it boils down to the fact that the situation is quite critical, and that these equipment and these tools of trade that they need to do their jobs to save lives are simply not there at the time. Let's take a listen to some of those sentiments from one of those healthcare professionals.
It's frustrating. It's hard because sometimes you find yourself having to choose who to save and who to let go. Here are patients in front of you. They need your attention, both of them. Sometimes you will have to choose, which one am I going to save? This one or that one? That's not life. The system, we always believe, it is using us as accomplices to murder. They are using us to kill people.
I am talking to one of the major nursing unions a little bit later on in the program, but that is very worrying. We have an acting health MEC in the province. What is he saying?
Well, the acting MEC, Jeremy, admitting, of course, that there are problems in the health sector, but he says the health system in Gauteng is critical but stable. So Jacob Mamabulu is saying, in fact, that the reasons why there are so many problems, these are long-standing issues, mind you, Jeremy, that we've heard. It's not the first time that we've heard of the issue of shortage of staff and the issue of overcrowding. But he says that one of the reasons why there are such problems in Gauteng in particular is because of the migration patterns that Gauteng sees, where you see other people from other provinces, for example, using some of our hospital facilities, and also people from other countries coming into Gauteng and merely clogging the system. So he admits that that's the problem. But in terms of staff shortages, the MEC is saying that that is an issue they're still trying to work around. They are in conversation with some of the unions to try and see if there are any issues. But of course, there are no short-term solutions to any of these problems. In the meantime, it means that the patients and ultimately the healthcare workers will continue to bear the brunt of some of these issues. But let's take a listen to what Jacob Mamabulu had to say in response to these issues.
The health facilities in our province are working and are running very well. However, that does not mean there are no challenges. And remember that we are managing big numbers every day, and if you also consider neighboring provinces as well, most of the people do come inside our province. So, and we don't have all the resources that are required to do the work. So the concerns of the workers, to a certain extent, yes, they will be correct, there will be challenges. We do acknowledge that. We have never denied that. We have actually always been the ones that says we do have challenges and we acknowledge them. But the healthcare facilities are working. We're providing an excellent service, good quality healthcare. And to that extent, we're always balancing, the two issues together. But in the main, and the dominant trend is that we're running a very stable public health care system.
Well, that's Jacob Mamabolo, who's the acting health MEC here in Gauteng.